as we are moving towards one of the highlight sessions and the topics of the day today, where we are right now, I would like to say, ladies and gentlemen, that if I wonder, the single biggest problem with communication often is that it is the illusion that it has taken place. Today, we are here projecting this platform where I would like to believe that we are in this together, where we want that there should be no such illusion existing. So let's absolutely keep our eyes focused as we're now going to talk about something very important, which is the consumer freedom, addressing the health crisis, the solutions, and the prevention at the same time. I'm sure your minds and at the same time your gadgets would be working at its best as you would be sharing the perspectives which are going to come from one of the thought leaders, the leaders who is, I must say, has so much to contribute in nation building, I must say. Well, our next keynote, ladies and gentlemen, is and would be spearheaded by the Honorable Joint Secretary, Ministry of Health and Family Welfare, Government of India. And we are so proud to be sharing that he would be sharing his thoughts with us on India's health manifesto: prevent, prepare, respond to future health related challenges. This is going to be unmissable as this is going to be super pivotal. Well, before I invite him on the stage, ladies and gentlemen, I would like to say that this veteran IAS officer has held so many key positions when we talk about in the past, including the Commissioner cum Secretary, Healthcare, the Human Services, the Family Welfare Department, Government of Sikkim, the Managing Director of the Uttar Pradesh Power Corporation, and has had the most beautiful experience of working in the departments of government, including energy, finance, and also healthcare. Well, he studied at IIT Roorkee, Niti Mumbai, and King's College London. May I say, ladies and gentlemen, that I am privileged, I am proud, and in fact very grateful to be inviting him on the stage. With all your kind applauses, please join me in welcoming on stage, ladies and gentlemen, please welcome Honorable Shri Vishal Chauhan. May we please request Shri Chauhan to please grace the stage, the Honorable Joint Secretary, Ministry of Health and Family Welfare, Government of India. Namaskar, sir, and a very, very warm welcome to you. They're all yours.
First of all, let me thank Economic Times for inviting me for the Global Business Summit. Health has been a subject very close to me. Now, almost for a decade, I have been working in the health sector in various positions. So I'm very happy to be here among the thought leaders as far as the health is concerned. Now, we recently had a budget announcement, and two very specific, announcements made related to health. One is that opening of the nursing colleges in 157 medical colleges of the country, and also the sickle cell disease. Now we are going for the elimination. So these are two specific announcements were there. Budget is an exercise where government gives its accounts, its receipts, its expenditure. It is also a policy statement. And when it is terms of policy, when the government is working 24/7, then policies are not made once in a year. It's a 24/7 kind of a policy. Reforms keep on taking place. And in this forum, I'll be talking about few major policy reforms which have taken place in the country, and how it is benefiting each one of us sitting in the hall and outside the citizens of the country. So one major policy reforms which has taken place is about in the medical education sector. When we talk of the last 5-6 years, we had a very limited number of colleges, and now the number of colleges has increased and the number of seats has increased many folds. There has been 87% increase in the undergraduation seats in the country if we talk of last 7-8 years. And post-graduation seats, there has been increase of 105%. So there's a major reform which is taking place now. The supply side is increasing. India is getting more aspirational. So we are getting more and more doctors, trained doctors in the country. And now with this budget announcement, we are getting more and more nurses also in the future. Another major reforms which has taken place, and it also touching the topic which we'll be discussing after my speech, is that a major reform is taking place in the primary healthcare sector. And earlier the primary healthcare sector was only limited to reproductive child health, where you have We are only bothered about the immunization and whether the 4 antenatal checkups have taken place or not. Now we provide 12 comprehensive services. So we have a now trained nurse in our primary health centers. We call it Ayushman Bharat Health and Wellness Centers. So we are not restricted only to the reproductive child health care. We are not now addressing the non-communicable diseases also. We are addressing the mental health care also. We are also addressing the ENT kind of services also. Altogether 12 kind of services are provided in the primary health care sector. And most important, which is also related to the topic now we will be discussing, is that curative part is not important as far as the health is concerned. The preventive part and the promotive health is also very, very important. Now, in each of the on 14th of this month, we had 150,000 our health and wellness centers organize a cycle rally. It is important that we every health and wellness center about 10 days in a month is organizing yoga session or a wellness session or a Zumba kind of activity, so that no amount of tertiary care facilities will be sufficient if you are not able to prevent diseases at the primary healthcare level. That is very, very important. It is a major reform taking place in the country when we are talking about prevention and promotion also, where health, yoga, the Zumba or the physical activities are taking center stage, and we have to ensure that non-communicable diseases have to be addressed at the village level, at the primary health center level. So that's a major reform. You will be surprised to know that the kind of epidemiological changes are taking place in the country. In the 1990s, about 30% people were suffering from the risk profile of the country was 30% of the people suffered from the non-communicable diseases. Now it is 63%. And what are the major risk factors? It's tobacco, it's alcohol, it's non-physical activities are the major risk factor before us. So this is how we can create awareness in our citizens about these risk factors, where and also if we talk of the cancers, every year 14 lakh new cancer cases are added as per the cancer ICMR cancer registry, and about 7 lakh people are dying because of cancer. And in the male, majority of the cancer cases are oral cancer, etc. And for which tobacco is the main cause of, main risk factor. So can we create awareness in the citizens that they should not have, they should discourage tobacco, they should discourage alcohol. Recently there is a WHO report that any amount of alcohol is not safe. Earlier the notion was that healthy drinking once in a week kind of a thing, but any amount of alcohol is now is not safe. So what does it mean is that we have to have more more awareness about what we eat, whether we do exercise or not. We have workplaces where we work from morning 9 o'clock to evening 9 o'clock. There is so can we change the way we work? Can we change the way we promote physical activities at our workplaces? Can we come to our offices in cycle? I understand the biggest problem with the cycles is that when we talk of cycling, we talk of road safety. So now smart cities are coming. Whether can we create tracks for cyclists and can we promote it? It is good for environment, it is good for physical health, it is good for mental health. So we have to address all these risk factors in the country. So I'll be also talking about one I said the primary sector reforms, where this is very, very important. And also a lot of new things are coming up in the health sector, is that whether we are going towards a saturation approach. Earlier we are doing everything but in a limited numbers. So can we cover all my citizens under non-communicable disease program? Because right now only 10 to 15% are taking medicine as far as their hypertension or diabetes is there, and out of that very, very few are in control of these diseases. So can we saturate each and every citizen of the country so that he does a screening once in every year and ensures that he is protected from these diseases? Can we cover? Can we now in this budget exercise, the sickle cell is announced. Can we cover each and every? It is a disease which is more prevalent in the tribal population. So can we cover each and every tribal population for do the sickle cell screening, and ensure that they are counseled about the marriages and pre-marriage counseling. So all these things are there. Now we are in our health system. We are encouraging a lot of startups. A lot of technology is also getting used in the system. So now earlier we had our test. Now we have a lot of point of care test. When the COVID started, the RT-PCR test was costing 3,000 rupees, 4,000 crore and per test. And now after the COVID, as the COVID progressed, the cost of test kept on reducing. So can we promote lot of startup in the health sectors? And finally, I will talk about a health ecosystem which is creating digital health ecosystem where every citizen is going to have a ABA ID. Now we have lot of our IT portals in our national programs. We have a RCH portal, we have a TB portal, we have a NCD portal, and these portals do not talk to each other. Can we create a health ecosystem where somebody getting treatment in a district hospital or in a primary health center, tomorrow he goes to Apollo or he goes to Medanta, can his records can be shared with the hospital, or can he, after getting his treatment, when he goes back to the village, can his records can be made available, what kind of treatment he has to continue at the primary health center. So now we have a digital health ecosystem where every citizen of the country is going to have a ABHA ID, ABHA number. Every doctor will have a health facility, every doctor will have a health professional registry, registered himself, and every facility is registered in the health professional registry. The whole idea is today I am looking after mental health also. I don't know in the country how many psychiatrists we have, how many passed out, how many are working in the country, how many have gone to abroad to work in other countries, and how many have gone into other aspects of life. So can we maintain a health registry? So we are trying to create an ecosystem where our portals, our systems can talk to each other. I always give an example. If a pregnant lady is also having a hypertension, so our RCH portal doesn't know she has a hypertension, our NCD portal doesn't know she is pregnant. So once if she is pregnant and she is a hypertension, it becomes a high risk pregnancy. So can our portals talk to each other and share with this? We share the information to each other, so that also kind of this thing have to be there. And lastly, I will talk about not only the risk factor, what we eat is also very important. So our food safety authority is running lot of program, so it is very important what we eat. There are personal experiences where things disease like diabetes can be controlled if we reduce rice and wheat and have more of millet kind of in our diet, millet kind of products. So what are we eating is very important. What kind of oil we are using, and so it is our duty that as a consumer, as a citizen, they should know that what they are eating, what is healthy for them, what is not healthy for them, and they can take a conscious choice. So with this I will end here. I talked about the recent reforms which is taken place in the health arena, and also how we can reduce the harm in the society, how by change in behavior we can and of course there are social determinants of health. Whether people how many friends you have is also will reduce your risk of there are studies which shows that how do you interact in the society is also related to your mental health, it is also related to your physical health. So I will end here. The idea is that we should ensure that health is not which only takes care only in the tertiary hospitals. It is important that health is how we live, how we think, how we behave, and what we eat is also important. And if we are able to have a control over that, then probably we will be in much better control of our health. Thank you very much.